When Elon Musk unveiled Neuralink, a company aiming to merge the human brain with computers, the world took notice. The idea of implanting chips into our brains sounds like science fiction, but it's rapidly becoming a reality. This race to connect our minds directly to machines is heating up, with numerous companies and researchers diving into this bold new frontier. But what does this mean for us? And is it safe? This is the story of the quest to put a chip in your brain. To understand the origins of this technological marvel, we need to look back to the mid-20th century. Neuroscientists began exploring brain-machine interfaces, BMIs, starting with simple experiments on animals. In the 1960s, José Delgado, a pioneering neuroscientist, famously demonstrated the power of BMIs by controlling a bull's movements with a remote control. These early experiments laid the groundwork for today's advancements. Fast forward to the 21st century, and the dream of connecting brains to machines has taken huge leaps forward. The potential benefits are staggering: restoring movement for paralyzed individuals, treating neurological disorders, and even enhancing cognitive abilities. This potential has sparked a fierce competition among tech giants, startups, and academic institutions to develop the most advanced brain chips. In 2016, Elon Musk founded Neuralink with the goal of creating high-bandwidth brain-machine interfaces. The company's vision was to help treat brain injuries and eventually enable a symbiosis between humans and artificial intelligence. Neuralink's approach involves implanting flexible threads, thinner than a human hair, into the brain, connected to a small device that sits behind the ear. This device, called the link, would communicate wirelessly with computers and other devices. At a 2020 presentation, Musk revealed a pig named Gertrude with a Neuralink implant, showing real-time data from her brain activity. The demonstration was a glimpse into the future, but it also raised many questions. While the technology seemed promising, the ethical, medical, and societal implications were profound. Would people willingly implant devices in their brains? What about privacy and security concerns? We're hoping to make this as safe as possible, and something you can get installed in under an hour, and then go home and go about your normal activities. The race to put a chip in your brain isn't just about technology, it's also about trust and acceptance. But Neuralink is not alone in this race. Other companies and researchers are making significant strides as well. In 2017, Facebook announced it was working on a brain-computer interface that would allow people to type using their thoughts. Facebook's project aimed to develop a non-invasive device that could read brain activity through the scalp. While less invasive than Neuralink's approach, it also presented significant technical challenges. At the University of California, San Francisco, researchers have been working on a speech neuroprosthesis that translates brain activity into text in real time. This technology has the potential to give a voice to those who cannot speak, such as individuals with severe speech impairments. The possibilities are endless, and the race to perfect these technologies is fierce. The competition is not just in the tech world. Medical device companies like Medtronic are also investing heavily in brain-machine interfaces. Medtronic's focus is on treating neurological disorders such as Parkinson's disease and epilepsy. Their deep brain stimulation, DBS devices, have already helped thousands of patients manage their symptoms. These devices send electrical impulses to specific parts of the brain, and future versions could become even more sophisticated with improved control and feedback. One company making headlines is Synchron, which has developed a minimally invasive brain implant called the Stentrode. Unlike Neuralink, which requires invasive brain surgery, the Stentrode can be implanted via the blood vessels, making the procedure less risky. This device has already been tested in humans, and early results are promising. Synchron's approach highlights the diversity of strategies being explored in the quest to develop effective brain-machine interfaces. While the potential benefits are clear, the challenges and risks are equally significant. The human brain is incredibly complex, and our understanding of it is still in its infancy. Implanting devices in the brain carries risks of infection, rejection, and long-term damage. There are also ethical concerns about the potential for misuse, such as mind control or surveillance. We need to have a very careful and thoughtful approach to this technology. It's crucial that we establish ethical guidelines and ensure that these devices are used for the benefit of humanity. the race to put a chip in your brain is not just a technological challenge, it's a societal one. Despite the challenges, the potential benefits are too great to ignore. Imagine a world where paralysis is a thing of the past, where neurological disorders can be treated with precision, and where humans can seamlessly interact with machines. The companies racing to put a chip in your brain are not just building new technology, they are shaping the future of humanity. The implications of these advancements extend far beyond medical applications. Brain-machine interfaces could revolutionize how we interact with technology, leading to new forms of communication, entertainment, and productivity. For example, imagine controlling your computer or smartphone with your thoughts, or experiencing virtual reality in a way that feels indistinguishable from the real world. These possibilities are no longer confined to the realm of science fiction. They are becoming achievable goals. As these technologies develop, questions about accessibility and affordability will become increasingly important. Who will have access to these advanced brain-machine interfaces? Will they be affordable for the average person, or only available to the wealthy? These are critical issues that must be addressed to ensure that the benefits of brain-machine interfaces are shared equitably across society. In addition to technical and ethical challenges, the development of brain-machine interfaces also raises significant regulatory and legal questions. Governments and regulatory bodies will need to create frameworks to ensure the safety and efficacy of these devices. This will require collaboration between scientists, engineers, ethicists, and policymakers to develop standards and guidelines that protect users while fostering innovation. One major concern is the potential for hacking and cyber attacks. As brain-machine interfaces become more integrated into our lives, the security of these devices will be paramount. Protecting sensitive brain data from malicious actors will require robust cybersecurity measures and continuous vigilance. Despite these challenges, the potential of brain-machine interfaces is too great to ignore. The race to put a chip in your brain is not just about technological advancement, it's about redefining what it means to be human. As we move forward, it's essential to balance innovation with caution, ensuring that these technologies are developed responsibly and ethically. The story of brain-machine interfaces is still being written. With each new breakthrough, we move closer to a future where the line between human and machine becomes increasingly blurred. This journey is not just about creating new devices, it's about unlocking the full potential of the human brain and exploring the limitless possibilities of our minds. Thank you for watching. And if you liked this one, subscribe to Luxe and check out some of our other videos.